Hi, this is Dr. Horowitz. Many of my patients ask me about new treatments for type 2 diabetes. It's a very interesting question because when I started practice about 20 years ago, we only had one class of non-insulin oral medications to treat type 2 diabetes. Now we have about a dozen. The question to ask is, why has there been such an explosion in treatments over the past 2 decades? The answer is our understanding about diabetes has really evolved, and with better understanding, we have new treatments to attack the different areas that we know play a role in the development of type 2 diabetes. One of those places is the kidney, actually. The kidney does a really good job about returning filtered sugar back into the bloodstream. And in type 2 diabetics, there is more sugar in the urine, and the kidney continues to filter that back into the blood, and that adds to the high sugars. So there's been a understanding of that process, and we found that there are actually transporters in the kidney that are the reason why the kidneys are so good about transporting sugar back from the urine into the bloodstream. Based on that understanding, there are new medications that block those transporters so that sugar can go out into the urine and less be in the bloodstream. Now, back in the old days, we used to think of sugar in the urine as a bad thing. We actually, before we could check sugars with a glucose meter from the blood, we used to check it in the urine. But now, with this new type of medication, sugar in the urine, as a result of that, can be a good thing. So with these new medications called SGLT2 inhibitors, we see decreased blood sugar, and also because you're losing calories in the urine through urinating sugar into the urine, people lose weight. The other benefit is that these medications tend to lower blood pressure because the total volume of water in the body goes down a little bit with the sugar that goes into the urine. So these medications can be very effective for treating diabetes and also for helping lower blood pressure and helping people lose weight. There are two of them out on the market, and there's several more in clinical trials. We're studying these medications at the Metabolic Research Institute, both looking at them for different aspects of treating diabetes and also for blood pressure. So if you're interested in hearing more about these studies, you should contact us at 802-3060, or you can email in at our website.